Hello, this is Dana, and welcome to my channel. If you aren't subscribed and you'd like to see more of this content, I would urge you to subscribe and ring the bell and ask to receive all notifications, and that way you'll be sure not to miss a video. Today is Wisdom for Wednesday, and it's going to be about breast cancer and mastectomy and what to expect. So if you have any small children that are close by, you may want to wait until you can view this in private, because I'm going to discuss some of the specifics of having a double mastectomy. Before the mastectomy surgery, in the hospital on the day of surgery, you'll be asked to change into a hospital gown and wait in a preoperative area. Some hospitals will allow you to have one or two friends or family members to be with you in the room. Your surgeon or a nurse may draw with a marker on your breasts where the incisions will be made. This is usually done with a felt tip marker. You will be sitting up while this happens so the natural crease of your breast can be marked. You will be taken to the anesthesia room where the nurse will insert an intravenous infusion IV into your hand or arm and tape it in place. Soon after this, you'll be given a relaxing medication, and then you'll be wheeled into the operating room where you'll be given general anesthesia. During the mastectomy surgery, it can take 2 to 3 hours. If reconstruction is performed at the same time, the surgery will take longer. Most mastectomy incisions are in the shape of an oval around the nipple running across the width of the breast. If you are having skin-sparing mastectomy, the incision will be smaller, including only the nipple areola and the original biopsy scar. If you're having a nipple-sparing mastectomy, a variety of incisions can be used. After the incision is made, the breast tissue is separated from the overlying skin and from the chest wall muscle underneath. All the breast tissue, which lies between the collarbone and ribs from the side of the body to the breastbone in the center, is removed. Your breast surgeon will also perform sentinel node dissection or axillary lymph node dissection if that is part of your surgery plan. After your breast surgeon has removed your breast tissue, if immediate breast reconstruction is a part of your plan, your plastic surgeon will perform the reconstruction. In the final stages of surgery, your breast surgeon will check the surgery areas for bleeding and insert surgical drains. Drains are long tubes that are inserted to your breast area or armpit to collect excess fluid that can accumulate in the space where the tumor was removed. The tubes have plastic bulbs on the end to create suction, which helps the fluid to exit your body. After the drains are inserted, your surgeon will stitch the incision closed. The surgery site will be covered by a bandage that wraps closely around your chest. After the surgery, you'll go to the recovery room where the staff will monitor your heart rate, body temperature, blood pressure. If you are in pain or feel nauseous from the anesthesia, let someone know so you can be given medication. You'll then be admitted to the hospital. Hospital stays for mastectomy average 3 days or less. If you have a mastectomy and reconstruction at the same time, you will be in the hospital a little longer. The morning after your surgery, your surgeon or nurse will show you an exercise routine you can do to prevent arm and shoulder stiffness on the side or sides where you had the mastectomy and help prevent the formation of significant scar tissue. Some exercises should be avoided until drains are removed. Ask your surgeon any questions you may have to make sure the exercise routine is right for you. Your surgeon should also give you written, illustrated instructions on how to do the exercises. Before you leave the hospital, your surgeon or nurse will give you information about recovering at home. One is taking pain medication, and you need to have a family member get it filled for you as soon as you're home so you can have it available if needed. And another thing is caring for a surgical drain, and they usually leave those in 1 to 2 weeks after the surgery. You'll need to empty it a few times a day, so make sure you get instructions on how to care for the drain before you leave the hospital. Stitches and staples. Most surgeons use sutures or stitches that dissolve over time, so there's no longer any need to have them removed. But occasionally you'll see the end of the suture poking out of the incision like a whisker. If this happens, your surgeon can easily remove it. Surgical staples, another way of closing the incision, are removed during the first office visit after surgery. And another thing that they'll let you know is recognizing the signs of infection once you get home. Again, they'll remind you about the exercises you can do with your arms. And they will tell you about recognizing the signs of lymphedema if you had auxiliary dissection. And lastly, they'll let you know when you can start wearing prosthesis or resume wearing a bra. And this is usually for a little while after the surgery. And sorry, the light cut off there. And they'll tell you how long you need to wait. While at home recovering from the mastectomy, you need to rest. You need to get extra rest in the first few weeks, and the doctor will give you those instructions. You need to take your pain medication as needed. You need to take sponge baths until your doctor has removed your drains and or sutures. You need to continue doing the arm exercises each day, and you need to have family and friends pitch in around the house, helping with things like meals, laundry, shopping, and childcare. In the months after mastectomy, you can expect to maybe have phantom sensations or phantom pain in the months after. As your nerves regrow, you may feel a weird crawly sensation. You may itch. You may be very sensitive to touch and feel pressure. Your discomfort may go away by itself, or it may persist, but you adapt to it. Analgesics and NSAIDs, such as acetaminophen and ibuprofen, can usually address the pain for this type of nerve injury. Opioids can also be used to treat this type of pain. Continue doing regular arm exercises, and you may also experience fatigue from time to time in the early months after surgery. If you're having trouble with the fatigue, ask your doctor about things you can do. And I got all this information from a website called breastcancer.org, and it was very helpful to me. My daughter will have had a double mastectomy by the time you see this video. Okay, I have some more light shed on the situation again. As I was saying before I paused the video, my daughter will have had a double mastectomy by the time you see this video. I hope that you find this information helpful, and if you know anyone that is facing this type of surgery, the intent and purpose of this is for you to share the video with them or direct them to the website where I got the information from. We ask you, please remember to be kind to one another, and remember we love you. Bye.